Hi everyone, welcome to this month's segment of Be Live, and this month we'll be discussing PrEP in the Black community, and we're joined by some fantastic guests with us, and I'll let them introduce themselves. So Vanessa.
Hi everyone, I'm Vanessa Apea. Gloria, actually I should have said thank you for having me. Hi. Launched in. So I'm Vanessa Apea. I'm a consultant in sexual health and HIV, and lots of my research is about health inequalities and ensuring that all communities are engaged in sexual health and HIV care and prevention. Nice to see you.
Nice to see you. And Harvey.
Hello, everyone. Thanks for having me, Gloria. My name is Harvey Kennedy. I am the CEO of Black Beetle Health. I am also a doctoral student at the University of Chester in the Department of Health and Social Care, so studying public health. We mainly sort of focus in my work. I sort of focus on sort of sexual health, mental health, chronic illness and disease management, and also sort of diversity inclusion within women's health as well. So thank you for having me.
Thanks for joining us. And last but not least, Judy.
Thank you, Gloria. Hello, everybody. I'm Juddy Otti. I have various hats I wear. I'm working currently with AAF, managing the peer support program, as well as a lot of PrEP background work that we've done together, and other preventative aspects of preventing HIV. I also work with Sophia Forum, and that is on a research around aging with HIV for women. I've done loads of stuff previously, even with Positive East around PrEP, and I'm really pleased that you called upon me to come today and share my knowledge and drive up this demand or knowledge. I won't call it demand, knowledge for PrEP in our community. Thank you very much.
Thank you, Judy. So my first question will be for Vanessa, and it's, how do we describe PrEP, or how would you describe PrEP to somebody? And yeah, how can people access it?
No, okay. So I think the first thing is always, because we're always using the term PrEP. So just so we're all clear what PrEP is. So PrEP is pre-exposure prophylaxis. And I always think as pre-exposure prophylaxis as you're taking something before an event to make sure you don't get something. So it's a bit like contraception. So you take contraception before sex to stop you getting pregnant. But for PrEP and pre-exposure prophylaxis, these are a set of tablets that you take before and after sex, and that prevents you from getting HIV. And so that the key thing in all of this is that you need to be HIV negative before you can take PrEP. But the reason that we're here today is that PrEP is suitable for everyone. The main thing about PrEP, in terms of thinking about when different people use it, is that there are different ways of taking PrEP and how you dose it. So the same way that as you take any other medication, how you dose it, and it's different for different people. So what I always say is that there's some really good information online, and one example is www.iwantprepnow, I think it's .org.uk, and there's some really good information there about how to take PrEP. But what's exciting at the moment, and finally, and thanks to all the advocacy of some really fantastic colleagues across the sector, is that we now have, within England, we now have PrEP free on the NHS. And I make the distinction about England because previously it was available in Scotland and Wales, but in England we didn't have it. The only way you could get it was on a trial, which was the Impact trial. So people may have heard of that. And to access that, you would need to get that from your local sexual health service. But now it is available on the NHS. You can now access it from your local sexual health service, but as we are moving forward, there are going to be more and more different ways in which you can access PrEP. And again, I know that Positive East will have that information on their website and websites like I Want PrEP Now. So please keep up to date on that, because there'll be more and more places that you can get it. But it's free, it's accessible, and you can also buy it online as well. But it is free on the NHS now.
Oh, fantastic. Thank you. So Judy, why do you think, or why do we see less Black people accessing PrEP compared to other groups, for example, white people?
First of all, I will say that unlike, statistics showing that the second largest people affected by HIV are people from Black and African, Black and Caribbean origin, we still don't see a lot of interest in PrEP in this community. And purely this is because there's a huge knowledge gap around what PrEP is, how it's taken, what it's for. We wouldn't expect people to access something they don't know. A lot of promotion about PrEP has been done mainly for the gay community, the white gay community. It's a lot of awareness has been created, a lot of knowledge is known, and therefore their level of confidence in PrEP as a product is a lot higher than the level of confidence in PrEP for the Black community. So I think one of the major reasons is because there is really a huge knowledge gap. Secondly, there is also very huge skepticism about it because the PrEP trial was introduced and the word trial had a negative connotation in this community. So a lot of people thought, I don't want to be a guinea pig, I'm not going to use this drug. So we still have to work around bringing a positive connotation towards PrEP, because now it's in the mainstream, like Vanessa has said, and trying to explain to people that that was not a trial. It was purely to see what the demand would be for PrEP once it's on the NHS. Now it's been commissioned, it's soon coming out, and it will be available to you on the NHS. If you think you need this drug, please make use of it. The third issue is our own cultures. These are subjects we don't talk about. A lot of times we don't talk about our sexual behaviors or our sexual preferences or what we do. And therefore anything around this is very stigmatized as a topic. And that doesn't help talking about PrEP, for example. But I'm hoping that using opportunities like this today will normalize this topic, normalize this subject, and also increase the inquisitivity for people to go and read up a bit more about this, go and find out factual information. And if it is something that is useful for you, please, please, please go and take this opportunity and use it. We had a lot of, in our PrEP and Prejudice project that we did with AF, we had a lot of feedback from a lot of people. First of all, they didn't even know it was a pill. They really wanted to see what this pill looked like. Then there was issues that the pill looked like HIV medication. So if I start taking this, people are going to assume that I am actually HIV positive. So there's all that we've got to deal, to kind of educate people about and try and sell the benefits of using PrEP and ownership. PrEP is something you can take very discreetly. Nobody needs to know you're taking it. It's not like you would have to announce, can we use a condom in a relationship? With PrEP, you can make the choice to use it on your own. You don't have to disclose it to the partner you're using it. It's something that puts you in control. And I think it's very important that we have discussions like this so that people can actually understand the benefits they would gain from accessing PrEP, so that we can reduce the numbers of new diagnoses. Most of the new diagnoses are coming in from this community. So we really need to address this somehow.
No, definitely. I mean, when I've been, because I'm part of the prevention and testing team, and sometimes when I'm testing clients and I'll mention the word PrEP, and a lot of people don't know what I'm talking about. A lot of people will be like, especially from the Black African community, they'll be like, what is that?
I completely agree. And I think as a clinician, the everything that Judy says completely resonates. And one of the things is that for you to take PrEP, you have to think that you are eligible for it, you're a candidate for it, that you are at risk of being exposed to HIV. And wrapped up in everything that Judy says, a lot of people don't see HIV as a possibility in their life, that they are being exposed. So therefore, when they hear PrEP, even if they know about it, they think, oh, that's not for me. And so some of what's really important as well is that healthcare professionals as well need to create opportunities to talk about PrEP, and I let people know that it's something that they need to consider as well. So yeah, it's really important for the two ways of that.
No, definitely. I've just had a question from Facebook, and somebody has asked, we know that adherence to HIV treatments is a challenge to Black communities. How are we going to support Black people to adhere to PrEP?
Yeah, I can jump in there and sort of answer that question. I think, there's something called consequence management, okay? And so it's part of that conversation you're having with this person who is seeking, assuming that they now know what PrEP is, they've come to the service, they're asking you a question about PrEP, and you're making generic recommendations. We really need to think about managing the consequences in people's personal lives, thinking about what their situation is, what their setup might be, what type of access they have, are they close to a clinic, how regularly might they be able to gain access to, regular checkups, their sort of, routine checkups for sort of liver and kidney function. How are we making that possible for them? How are we asking questions? How are we making recommendations, both in a clinical setting and in a community setting as well? So just, being really careful not to sort of make more generic sort of recommendations, I guess, really ask sufficient questions to give us an idea of what consequences we need to manage. So is a person, if they're LGBT, IQ+, are they out to family? If they are in a married relationship, how can they go about explaining to their partner that they're accessing PrEP? Why are you accessing this? Why are you taking this whenever you have sex with me or before you have sex with me? Thinking about the whole patient and, sort of their lifestyle outside of what we see when we consult with them. So I think that's one way I could definitely recommend, is just asking more questions and making more specific recommendations as opposed to generic ones.
Okay.
Yeah, no, completely agree. I think so a lot of my work with those that are living with HIV is supporting those that have may not have engage as well, or have difficulty staying on treatment, or find the treatment difficult to take. And exactly that, you've got to identify and recognize what's important to them and what's stopping them, not because they are a Black person or they are someone from Nigeria and they etc. Them, who are they? Martin, Patricia, who are you? What is going on in your life, and what can we do to support you bringing something that will cause a positive enhancement of your life? So it is reframing that conversation, but making sure that they are at the core of your conversation and not just a generic approach.
Okay. Yeah, I mean, when I worked for an organisation in Leeds, and we used to have a peer support group for people accessing PrEP. So we'd meet once every few weeks, people would have a discussion, how people are going with it, and how to sort of navigate those conversations you discussed as well. So I think sometimes people find it easier when they're talking to somebody else who's in exactly the same shoes. So if somebody else is accessing PrEP and they've been having those conversations, or maybe they've been accessing PrEP longer than somebody else, then they're more confident in having those conversations with other people who maybe, have newly started PrEP and things like that. So yeah, I totally agree. So this is
Gloria, sorry, touching on something that you've said, I think one thing we found when we did the PrEP and Prejudice project was having PrEP champions, lived users of PrEP, talking about their experience, especially in our community. It builds a lot of trust in terms of it works when you can use it, because I think one of the barriers we found, or one of the issues that hasn't been fully addressed, is the way PrEP can be used in the white gay community is very different from the way PrEP can apply to the Black community. The behaviors are different, and it's trying to understand those behaviors and trying to tailor PrEP to that. And using PrEP champions would be a very, very good way. And I really hope we can develop that and have more people talking openly about their experience using it, about how they've applied it, and that will build confidence. And I think once you have that, then someone adhering to PrEP while taking it will be a lot easier.
Definitely. So yeah, I've got a question for Harvey. What do you think the barriers are for getting more Black people to access PrEP?
Well, I think we sort of touched on that already, really, in some of the things that we said. But really, we talk about sociocultural factors such as faith. We're talking about religion. We're talking about access to sort of education. What circles are you mixing in? The likelihood of you actually coming across a conversation where someone mentions PrEP. I think there's an assumption there that because people put it on certain platforms, and they say, "Oh, we put it on the NHS website." What do you mean you didn't know about it? Thinking about who's accessing the NHS website. Okay, what are the places that people are actually already accessing information? It might be something that has to do with events. It might have something that has to do with music. It might have something to do with fashion. Are we accessing the other platforms where people are already accessing for other reasons and trying to invest sort of resources into just placing that acronym there? Just that PrEP. Are we making that visible even subliminally? Are people able to pick up on that information? And so it's really thinking about how we advertise it, how we promote it within health promotions. Are we considering who we're trying to reach? If you put it on a platform that's predominantly, white accessed, you're going to hit a lot of white users, and those white users are going to find out that information. Great, that's amazing, because we want everyone to have PrEP. But what about those who don't access that platform regularly or at all, really, to try and find out about PrEP? Are we thinking globally? Are we thinking more diverse in the ways in which we're advertising these things? I mean, that's when you're talking about sort of Black populations, that might be Black African, Afro-Caribbean, trying to access information. Where are we? What are we accessing in our free time and our spare time, and how can we sort of try and collaborate with these types of platforms to ensure that the message about PrEP reaches those places as well?
No, definitely.
Can I just add, I think also how PrEP has been packaged as a product. A lot of the adverts, a lot of the videos have been done for MSM. They don't apply. So I know in the pipeline, I know PrEP for Women are doing, Sophia Forum are doing some videos that will be tailored to Black communities. I know Positivist has done a few things tailored to Black communities. PrEP and Prejudice produced campaigns targeted, and a lot more work is coming. THT is bringing up some other things targeted, and this will help tailor this product better so that people can relate to it.
Because I completely agree, because I think that one of the things is that we always forget is also about sustainability. So what tends to happen is that there is funding that is given for an initiative for Black communities, whether they're heterosexual, whether they're LGBTQ plus, or, and it's given for a year. And then you're meant to roll everything out, and then the funding as well stops, and then that initiative doesn't go on. And I think there's something about, it's about repetition. It's about being in the right places, but also ramming it in people's faces as well. And if we think about PrEP in the white MSM community, it's been there, the messaging has been there for a long time, and it's constantly repeated. But I think in Black communities, we haven't had that same replication. So we haven't been at the right spaces, and we haven't been at the right spaces for long enough as well. And that's what I'm really hoping that in this next phase, where it is widely commissioned, that we focus on that we're in the right spaces for long enough, and we just have that sustainability with it.
No, definitely. I totally agree with what everybody said. Yeah, I mean, knowledge. I think that's one of the things we've all highlighted, the lack of knowledge. So encouraging people. I mean, Judy touched on the fact that Positivist have been doing some work. So, I mean, we've got a video that was created called Mama Says, and that talks about PrEP. And I think that will be, it's on our Facebook page. So people can access that there as well. And I think it's also important to create things that stay there. It's all well and good doing things that, one-off events and here and that. But if people can't regularly access that information on their own through different platforms and different places, I mean, that's why it's important to have the champions as well that was mentioned, people that can be continually having those conversations in their communities, which I think is a very important thing. So another question I'd had is, where can we signpost people to? I mean, off the back of these conversations, I think somebody mentioned, I think Vanessa, you mentioned, I want PrEP now. And where can we be signposting people to get information and to read up on PrEP?
So we've got womenandprep.org.uk as well. And I think all the community organizations, so actually, congratulations, Harvey. You've just got charity status, I believe. Yeah, there we go.
Yes, thank you.
So, no, but I think it's great because I think all the community organisations, Black Beetle Health, Positive East, Africa Advocacy Foundation, NAS, you know, every organisation has relevant information there. And I think just picking on what Judy said is also, we also as a community have a responsibility to seek that information. So we in the sector have a responsibility to have it there, but then we also have to make sure that people know where it is and then encourage people to seek it as well. So there are really many platforms online which have information about PrEP in general, how it would suit you and where you can access it. So I would just encourage people to go on those different websites, and you know, you'll like the language on one website better than another, and that's why it's good to just go in different ones to see what resonates with you. That's what I would say.
And just as you mentioned that, Vanessa, you know, it's really important to understand that there are so many websites, and that can be good, but that can also be bad. But, you know, it can also be bad, not because people have too many options, but because, you know, not all the websites are always credible. And this is something that we have to be really careful, you know, about with PrEP, is that we want to make sure that looking at, for example, you keep hearing, I want PrEP now. And the reason why we're saying I want PrEP now is because in going to that website, it's not just a button that you click and say, well, now I can get it. It might have other guidance. It will have other options of websites that you can access that are considered sort of safe, you know, because I know that a lot of people would try to, you know, say, oh, we can sell it to you cheaper, okay? We can give you half price. There's a reason that's half price, and it's really dangerous to sort of engage with platforms that might not be credible, that might not be supported by, you know, actual clinical studies. You know, they're just sort of like another type of pill that they're trying to make available to make a profit. So, you know, really steering clear of those websites, doing your research and understanding that maybe I want PrEP now, or, you know, Women in PrEP is a great place to begin, because we don't want to sort of mislead people and tell people, yeah, go out there and just, you know, Google. You know, that's really quite dangerous when it comes to sort of protecting, you know, your immune system and, you know, making sure that you can have a good, healthy drug response, you know, when you do choose to go on PrEP, if you choose to go on PrEP, that, you know, that can be effective for you. Because if not, you know, you might be, you know, on a certain type of PrEP that was not accessed on a mainstream type of website for, you know, 6 months to a year, when you realize, oh, I was taking the wrong thing. You know, that can really tamper with your body's ability for that to be effective. And that's something that we want to try and emphasize, particularly in marginalized communities who might be quite secretive about accessing PrEP and trying to, you know, trying to keep it on the wraps. And, you know, they find a website that's more discreet, seemingly more discreet, and so they end up getting themselves in a bit of a tangle. The second thing that we sort of speak about in a lot of the work that we do in LGBTQ plus communities is chemsex, and people sort of equating chemsex practices with taking PrEP in non-traditional ways. We know it's typically taken orally, okay, but we have this issue with people, and Vanessa, you might want to jump in there and say that as well. You know, people take snuffing it or trying to shoot it as if it's some type of drug in that way, and that is not, you know, supported at all, you know, clinically. That's not something that we want to encourage people to do, you know, because they think it might be more effective. PrEP is perfectly effective taken orally under the recommendation of your GP and supervision of your primary care physician. So, you know, it's really important to sort of think about those other factors as well.
No, yeah, just adding on to that, I think that that aspect is so important as well, because when people hear about PrEP or go into some websites, they may kind of people interpret things as they want to interpret. And so if you're not on a reputable site, you may think, oh, actually, do you know, I can snort it. It's just the same. It's just, you know, I'll get the same concentration. And actually, I may even get it more because I'm going to have, you know, people make these things up. And it's just really important that to go on reputable sites, to be really clear that that is not the way to take it. There is a standard way of taking it orally, and that's where we've got the studies and we know that it's effective. And just also, as Judy said, the impact trial was not about making sure that we knew PrEP was effective. It was just thinking about what was the best way to roll it out. But there were many studies before which looked at whether PrEP was effective, and we knew it is effective, but we knew it was effective by taking it orally. So you have to understand where we got to and where we're going with it, and not to be led on a different path with it. So no, Harvey, completely agree. It's so important to be clear about the right sites and absorbing the right information from that.
Okay. And yeah, so what would, I mean, I had somebody ask me a question earlier, and they said, Am I frozen? Did I freeze for a minute there?
No, you're okay.
Oh,
You're okay.
yeah, I had someone ask me a question earlier, and they were like, what would you say to somebody who doesn't believe they fit the profile for PrEP, for example? I've had people in marriages, and they've said, you know what, PrEP wouldn't apply to me. What kind of conversations should we be having with people that say, I'm married? And I've had that conversation before, you know, marriage can't protect you from HIV, but what kind of, you know, conversations should we be having with these people, and how should we be getting that message across that, you know, PrEP is available for everyone, and it's not just for men who have sex with men. Judy, yeah.
That brings me back to my point around the PrEP champions and experiences, and I'll use one experience. I'll come to your marriage scenario later, but with this particular person, they were in a long distance relationship with somebody outside the country who was HIV positive, but because they were in another country, they could not guarantee whether they were still remaining undetectable. And so they, whenever they traveled back, they used PrEP during that time they were with their partner. That's a scenario where PrEP can be applicable. In a marriage relationship, going back again to our own cultures, where partners have several sexual partners, and in some cultures that's allowed, you have nothing you can do about it. So how do you protect yourself in that relationship? PrEP is a very good way of protecting yourself in that relationship. It won't protect you against any other STIs, but at least it will protect you against contracting HIV. And there are many scenarios like that that apply, even when people are married. If you know that if you know the other partner is having various other sexual partners, and you cannot introduce a condom in the relationship, then you have an option. We're not saying PrEP is for everybody. I think this is something we have to make really absolutely clear. We're not saying PrEP is something that gives you a gateway to be promiscuous. No, it is control, it's choice to prevent you from contracting HIV is the bottom line.
No, that's very true. I think it's very important for everybody to try and take control of their own sexual health. If you're responsible for your own sexual health, that's the best thing you can do. If you can make decisions and choices that put yourself first, that's the best thing you can do in any of these scenarios. And I think that's really important a really important thing to bring up. I'm just going to check if we've got any more questions on our Facebook. I don't think we do.
Gloria, just to add into that, because so the way that I always say to people is that if you are HIV negative and you are having sex, you need to know about PrEP and you need to consider it. Now, considering doesn't mean it's for you, exactly as Judy said, it's not for everyone, but you need to consider it. And then that's the kind of platform that I use in terms of then you considering what your relationship is. And if it's that you are married, but you know what I always say, you know the choices that you make every day, but you may not know the choices your partner makes every day. You may assume you know, but you don't fully know. So it's not about engendering mistrust in relationships, but it's just saying, you know what you're doing. You may not know what your partner is doing. This is something that could bridge the gap of that. And then it's your decision to say, right, actually, do I think I want to bring that in or do I not? But at least someone has that control of it. But I think all of us working in the sector, we can all have experiences that you actually have to have quite some frank conversations to people about sex, and also considering whoever you're having sex with, what is going on in their life as well. And often, because of our culture, because we don't like talking about sex, because you think a conversation about sex should be one-dimensional, you may not have ever even thought outside of the box about sex, about what that person is doing. So it's another opportunity just for people to think about what's happening in their relationship, and also giving them the power to do something as well. So it's just framing it as like that, I think, as well.
Yeah, definitely. really true. We've got another question from Facebook. Somebody's asked, how do we fit the message of PrEP when working with faith communities? So when we're working with, Christians, Muslims, and different communities who often frown upon discussions around sex, sort of sex before marriage and things like that. What kind of ways could we package this information to sort of get the message across to these groups?
Yeah, well, I guess I'll jump in there and say something about that. At the same conference we attended back in February, I think that was the conference back in February for HIV education. We were looking at ways of working differently. There was one of the sort of workshops we went to, and they were really trying to understand this question: how do we bring PrEP? How do we bring sexual health to to faith communities? How can we even start that conversation? Because at the end of the day, no one has sex until they get into a married relationship, right? And then once you're in that married relationship, you only have sex with that person, right? No, that's not necessarily true, because at the end of the day, we're all human. My dad was a pastor before he retired, and this is something that I could not even imagine them having sort of an afternoon session to discuss. But what they were talking about is trying to integrate it into marriage counselling, because that's something that everyone, certain people in certain communities, within faith communities, do go through. They do consult with their a sort of faith leader and try to get the blessing, before they go through anything official. And that's a great opportunity to say, by the way. But that would mean getting buy-in from faith leaders. It would mean sort of getting in there and forming a relationship with these communities, not from a distance, sort of saying, come to us, but maybe going into them. It might mean something so much as sitting in a service. People say, I don't want to go sit in a service. It might mean sitting in a service. It might mean listen to that entire sermon. It might mean taking that blessing and then making your 2-minute announcement, okay? Because we have to go to people. And sometimes we're not willing to do that. We're not willing to make that a part of our outreach or a part of, our integrated, public health or sexual health practice. But we do need to be thinking about how people exist in their own communities. And what are people doing? Many of them are seeking marriage counselling. What are people doing? Many of them are going in for other health checks, other health questions. Is there a church nurse that might be doing weekly announcements? How are we integrating with the church nurse to ensure that can be part of a message? And how can we, sort of give her confidence around that so that she can speak about it with some type of authority? She is a clinician. She is she does work in a clinical setting. Likely in a lot of these situations, she might not even come across it herself. How can we provide training for that nurse or for those leaders within communities to be that advocate to sort of go in and have those conversations? Working differently and not making excuses about hard to reach. And I'm going to leave that right there.
I love it, because I think that as soon as we mention the word faith, then everyone always becomes on tenterhooks about it. And again, as someone who, my grandfather was a minister as well, and you've got to, that's where people are. That's where people are living their lives. That's who's informing their decision making. And you'd be surprised about the power of the wider church or wherever faith setting in their decision making. And so an example, one of the groups I think is really powerful within churches is the First Lady of the church and the Women's Auxiliary. Listen, there's so much power there. And a lot of the work I do in Ghana, I actually work with the First Ladies of the church, because they're the ones who will be, if they're, thinking of the standard structure, if their husband is the one that's running the church and they're close to discussing about sex, HIV, PrEP, etc., normally the First Lady is the one that you can go to and say, look, this is why we need it. And they will be the conduit to the pastor, but they'll also be the conduit to all the women of the church. But you have to think differently, and you have to be brave as well. It is awkward. It can be difficult having those. And when I first of all started to do conversations in churches, it doesn't matter how chilled you think you are, open you think you are. I reverted to the 5-year-old in front of my, my granddad. I can see my granddad there, and I'm talking about sex and relationships. But I think when you see the power of that, and you see the power of going to people where they are, then you see that we mustn't stop. We've got to keep going to where people are and removing that narrative of hard to reach. So yeah.
No, that's very true. I think
my take, I have done a lot of work with faith leaders, and I have gone and spoken in churches. And one faith leader I worked with told me, you know, we have to remember that all the people who come to church are wounded people. If they were not wounded, they wouldn't come to church, because they come to church looking for something. So we should not assume they're perfect. So if you approach it from that point of view, PrEP is a choice. It is something that you can use if you need it. So is abstinence. So is using a condom. We're not saying go out and be promiscuous or go out and commit adultery. That's not what we're saying. But at the other spectrum of all of this is everyone is human. And we really have to acknowledge that fact that everyone is human and give them the right tools. Because when we go back to statistics and we look at 44% of new diagnoses being from the Black African community, some of these are going to be people who go to church. I think we should not assume that these are people who you want to box in a certain scenario. No, they're everyday people who are married, who are in long-term relationships, who might be pastors themselves. So in order for us to stop new diagnoses happening, let's empower our people with choices and let's make them. I think for me, God would be really upset with me if I didn't convey that message to people so people can make informed choices. I think that is wrong.
I mean, definitely, Judy. I think when it comes to flipping the script a tiny bit and reminding people that you're not accessing PrEP because you're doing something wrong. What PrEP is going to sort of enable you to do is to do more than you'd be able to do in a safer way with consideration for other people around you. Like Vanessa said, you can't control what other people are doing. Sometimes you can't, the conversation is not about stopping people or telling people they can't do something, but it's about providing a tool, like you said, Julie, to enable people that as they're going through their daily life, things they can control, things they can't control, they have a tool to enable them to do that safely. The question comes to mind, from those who make decisions, from those who are, invested in creating access or have the ability to create better access for people in marginalized communities. Do you care? Do you care, right? Because if we don't care about it, we wouldn't do it. And when we don't do things, it sends a message that we don't care enough about it. So it's really asking yourself, am I invested in this? Do I care about this? Because if you don't care, then just be honest about that, because there will be people who do care about it. But really asking yourself generally if you care about something, and then be invested in that thing all the way. And that might mean promoting it in ways that you're not used to doing it, and ensuring that people can get access to these tools. Because at the end of the day, it's for personal betterment. It's for people to be able to live more full and more free lives in a way that they have more control over. And that's something that we really struggle with, particularly culturally, having control over much. Because it's those elders that actually have a lot of the control or the influence within our lives, and sometimes we don't have the choice. So it's sort of introducing the concept of having a choice, is what I think PrEP is all about. No,
definitely. My colleague Badru has created a really good piece of work about HIV awareness in the Muslim community. So he's done that over a period of time, and it's fantastic. And I think we can put a link to it in the chat. But I think also what I found personally working in different faith communities is you're going to get knocked back, and you have to become really resilient to what when you're interacting with people. And I think it was really interesting when Vanessa mentioned how she reverted to the 5-year-old when talking about when talking about sex. And I feel exactly the same, because you're often met with a lot of friction, when you're talking to sort of maybe the pastor. And I think it's really interesting about looking at different ways, like you said, talking to the First Lady and equipping communities with choices and allowing them to make those choices by themselves. And I think that's the only thing we can do. We can allow, as long as the information is out there and it's culturally appropriate, they can make those decisions, by themselves. But yeah, before we wrap up, I'd like to ask, does anybody feel like there's anything they'd like to add, or anything they'd like to advertise, or they'd like everybody to take away from this conversation?
I guess, as Vanessa alluded to, we're sort of celebrating at Black Beetle Health, we're celebrating recently getting registered charity status, which is, if anyone's ever gone through that process, an extremely difficult process to go through. But I stand by the work that we do at Black Beetle Health. We are a registered charity and grassroots community organisation who, we focus on providing evidence-based, peer-reviewed information for, across sexual health, mental health, chronic illness and disease, and also women's health and inclusion for LGBT people of colour, because, we do see people of colour organisations, we're focusing on Black African and Afro-Caribbean groups. We see LGBT groups and they sort of specialise in a lot of things, but we very rarely see the overlap. What happens to us in the middle? Okay, well, we're not accepted by sort of BAME organizations because there's just that one little disconnect they have because you happen to be queer, you happen to be LGBTQ+. And then you go into LGBTQ plus circles, and race then becomes an issue. Just making sure that we understand the intersection, okay? I wasn't going to say intersectionality, but I guess I've said it now, so I'm going to go in there, okay? So it's that, there are intersections that we sometimes overlook, and those are the gaps. We talk about closing gaps, working within gaps, trying to design interventions that address the gaps. These are the gaps we're talking about, the intersections that sometimes are not really represented in organizations. So, giving a comprehensive service is really what we focus on at Black Beetle Health. So please, yes, follow us. That's really great. But even better than that, you could share the content. You could attend, our any workshops that we have or any webinars that we have, and share that information, because it's very rare that we have that gap sort of being filled, and we want to have more valuable conversations.
Yeah, I think Alex has added the link to the Facebook chat. So if anybody wants to access Black Beetle, that they can access the link through the Facebook.
For me, I would say, just building on that, is we need to keep the conversation going. Harvey said he didn't want to mention intersectionality and, didn't want to go to the BLM stuff, but I think that if there has ever been a time where it's about advocating for ourselves and having an intentional advocacy and saying, right, we need people to know us, understand us, and respond to us and give us what we need, this is the time to do that. And I think PrEP is a really perfect example of that. There is something that affects us significantly, and there is something that could really has the potential of eradicating that. And so we need to get it out there. And we need to know about it. We need to discuss it. We need to be champions and make sure that people know about it. And so we just need to foster these conversations and keep it going and sustain it as well, and not to be kind of a tokenistic response that can often happen in, diversity and inclusion initiatives. We want this to be, right, this is us, we need it, and we're going to keep on getting that message out there. So yeah, that's what I would say about that.
I think it's also important to highlight we are people who are very discreet about our lives, about the choices we make, about the consequences of the choices we've made. We are, I don't know, culturally, I don't know where it stems from, but we are very discreet about things. And maybe that hinders us in trying to make good choices, especially when products are out there and we think, I don't want to be seen accessing this. I don't want people to know I'm doing this. Now is a time, like Vanessa has said, that we need to own up and take ownership for our own health, especially when services are being provided. We really need to stand up and engage. And this, we all have a role to play. Even if you as a man in the house or as a mother or as an auntie may feel PrEP is not something for you, please pass this message on to somebody else, because it might be useful for them. It may not be useful now, but down the line it might be. I think for me, what hurts me most is in the age we're in now, there's so many things that are available, tools that are available to avoid contracting HIV. I don't think it is fair for someone in this day and age to contract HIV if they have been given the tools to avoid contracting HIV. Our numbers are still very high. And while we can talk about the intersectionality that was brought in, let us be proactive and try and change the narrative. That's all I'll say.
Thank you. But no, it's very true. I mean, I'm currently doing my master's, and I was looking at PrEP in different countries, and coming from Kenya myself, I didn't realize PrEP was free in Kenya. I didn't know that. And if I didn't know that, I was wondering how many other people didn't know that because it wasn't advertised well. And as you said, it can be seen as quite sad for somebody to acquire HIV at this day and age, because there are tools and options and things for them to prevent that happening. So making sure people have the knowledge and the tools and the resources to access those things is really important. But I'd like to say thank you all so much for joining us. It's been a fantastic session, and yeah, take care everyone. Enjoy the rest of your Saturday.
Thank you.
Thank you very
Thanks
much.
for having us.
Brilliant. Thanks, Gloria.
Great.